All right. It is 8 o'clock Eastern Time. And I want to welcome all of you and thank all of you for joining us today. We are here to talk about how to break into the clinical research industry in today's market. There's a lot of news out there right now that things are changing, and we're going to discuss some of those changes. And it's really a great honor to have this opportunity. My name's David Silberman. I'm the co-founder and CEO at Clinical Research Fast Track. We're an organization that helps people enter and advance in the field of clinical research. Since 2016, we have helped a couple thousand people enter this industry. They're working at all corners of the industry. We've trained principal investigators. We train the coordinators who run the trials. We train people at the CROs and people at pharmaceutical companies. Our graduates of our program are working from coast to coast in almost every role you could imagine now, but they all started at the beginning. And today, it is my great honor to introduce our guests. And actually, I want you to introduce yourselves. So starting with Ian. Ian, you are one of the newest members to our career team, to our illustrious career team. Can you share a little bit about your background, what you do at Clinical Research Fast Track?
Absolutely. Hello, everyone. My name is Ian Fetterolf. I have over 10 years of experience with education and 5 years specifically with career coaching. It's been wonderful helping so many different students learn our language. 2 years of my experience has been overseas in an international setting with the United States Peace Corps, where I learned so much about empathy and really making sure our students know their why and that confidence on that why. So that's a little bit about myself. I'm eager to meet a lot of new people with our next class coming up. I want to say next month, David.
All right. And thank you, Ian. We also have with us Julia Martin. Julia has been with us for, oh my gosh, how many years now, leading our career team? Julia, how long has it been?
Just over 4 years. So yeah, my name is Julia Martin. I'm head of career services here at Clinical Research Fast Track. I have over 9 years experience as a professional career coach. I have a background in workforce development, and I've also supported hiring teams as well. As mentioned, I've been with Fast Track for over 4 years now, and I support our career coaching team in keeping our resources updated, our curriculum updated, and staying ahead of industry trends. I love what I do. It's very obvious, and there's literally nothing better than getting a message from one of our students saying that they just landed their dream job and we were part of the process. So I'm happy to be here today. Thanks, David, for giving me a chance to introduce myself.
Of course, and thank you for helping so many of our students. And we have Courtney Herman coming from the great state of Pennsylvania. As our outreach associate, Courtney, what do you do at Clinical Research Fast Track?
Yeah, David, thank you so much. Hello, my name is Courtney Herman. Like David had mentioned, I have been with Clinical Research Fast Track for just about 3 years. And in my role as the Outreach and Engagement Specialist, it really centers around networking with hundreds of research sites, and hospitals, CROs, and other partners that we have across the country. And then with that, we also love to help connect our students to open roles and breaking into this industry. One of the things that I absolutely love about my job is really helping all of our students break in and just get into their dream jobs.
Beautiful. Well, thank you all for being with us today. This is the first time we've had our career team on a webinar. We're always normally introducing our incredible instructors who are leaders in the field, and they're the ones who are training our students in how to conduct clinical trials. And for those of you who aren't aware, clinical research is a field where we're testing new treatments, new drugs, new devices, and new procedures on humans to determine safety and efficacy. And when we know that these drugs or devices are safe and that they are better than anything else on the market, they become approved by the FDA, and they are then available for doctors to prescribe to the general population. This is a really exciting industry. There's a lot of opportunity and a lot of wonderful room for advancement and growth. But what we've heard is people struggle getting in. In fact, many students come to us because they've been applying to jobs and they're not even getting an interview. And so they're wondering, what am I doing wrong? Do I have the right experience? And there's a few things that everyone needs to get in the industry. It's very helpful to have the training that we provide in clinical research. But in addition to that, the career assistance is critically important. And we help our students with things like resumes, cover letters, and networking, and we're going to talk about that today. So I just want to jump in. I hope you all have a pen and a piece of paper because we want to share our tips and information that's going to be really helpful for all of you. And that is our goal today, to really let you know some of the things that you need to do to get noticed and to get into this field. It starts with a resume. And Ian, I want to go to you and I want to ask a question that I don't even, I'm going to ask this question.
You, David, go for it.
If you have never heard of this, write this down because it's important. Ian, can you explain to our audience, what is an ATS system?
All right, guys. First acronym that I want you guys to write down is ATS, specifically an application tracking system. And I really want to question you guys real quick. How many of you guys think that when that resume is first seen by the company, it's first seen by a human being? What do you guys think? 50%, 60%, 70% chance? Guys, 80% to 90% of the time, that resume is going to go through an ATS. And that's a fact from 2025. And that's something that you guys can look up through Business Insider. So ATS is something that I really want you guys to look into. And one thing that we help you guys here with at Clinical Research Fast Track is making sure that you guys have keywords, making sure that you guys know that and feel confident, not just to put it on your resume, but also to be able to talk about it in the interview. That's one thing that we can offer. I hope that helps in some way, David.
Gotten everyone's attention. They've got to get through the ATS system. But let's talk about resumes. Okay, can you share with us, Ian, what is a common mistake that people make on their resumes? What are you seeing that's like, ooh, no, don't do that?
Absolutely.
What are the don'ts? And then we'll get into the do's.
Absolutely. So some of the
All right,
first,
Ian.
yeah. So some of the first, is everybody hearing me all right? Everything coming on in clear right now? Good, excellent.
Yeah, we're good.
So some of the don'ts that I really want to make sure that you guys know is that table that you were planning on putting in there with all that fun facts and information you put in there, that cool photo of you out, maybe learning, showing all that great stuff, you and your scrubs. I want us to ditch it. And why? Let's go back to that first acronym. What was it? ATS. Now let's think about it. When we think of an AI and list those AIs, what AIs are really people using nowadays? We got Gemini, DeepSeek, ChatGPT, ring any bells? If you overload those systems, sometimes they can't understand, especially if you're uploading in a doc format or a PDF format. So some of those don'ts, let's go ahead and leave that photo at the door. Now, do's, things I really want you guys to focus on is just simple consistency. I'm going to pass this mic on over later on to someone who's going to talk about cover letters, making sure that your LinkedIn also looks the same. I had one student who sent me one resume that was 4 pages long, and every single experience had a different style of bullet point. One was round, one was square, one was triangle, one was crazy dots. Let's get real, guys. It's confusing. It's not really professional. We want to see consistency, same font spacing, same font size, things like that. That's all I could ask for, especially if I'm on my upteenth resume for the day. That's what a hiring manager is thinking. I hope that helps, Dave.
Okay, so you want consistency, you want to get through the ATS system. How do you stand out though? I mean, imagine there could be 100 people applying to a job. They may not be qualified. They may not have the experience, and it may not be a good resume, but how do you get noticed with a resume? What can we do?
A lot of people are ditching the summary, or I'm seeing people just not being consistent with their summary, David. So I really want you guys to write that down. Let's make sure that we talk like a hiring manager and we defeat that imposter syndrome, right? I want you guys to be confident after a course like how we have. I want you guys to know those acronyms. ICH GCP, you might want to write that down, FDA regulations, Alcoa C principles, all these things, these are key buzzwords that really shows that confidence for this role. And we want to make sure that we install that into our resume. We don't want to forget about it while we're taking the course. We want to list it as a key skill that we'll feel confident that we can bring to them and more value to their company. Hope that too helps, David.
But you mentioned summary. Like, what is a summary? Like, some
Absolutely.
people
Well, it's
don't have
something
one.
that lets me know that you care, right? I could list duties all day. Let's get real, everybody. I could tell somebody the job that I do, right? Or you could prove to me that you've excelled in this, that you've had measurable achievements, that you've shown that you love what you do. That's what I want to see in your resume. I don't want to just see that I summarized reports. I want to see how you knocked it out of the ballpark. And that's whenever we get into quantification of success. But I've said too much, David. I really.
Okay. All right. We're going way down the rabbit hole. But before we start talking about cover letters, which is another important component, right now, Ian, there's this miracle support system out there called AI. We've got ChatGPT, we've got Gemini, we've got Anthropic. Can I use AI in my resume?
You know what, David? I think I'm going to have a lot of echoes. There's going to be an echo chamber tonight between me and the other three professionals here. Let's use it as a collaborator, right? Let's think about it this way, right? One time I took my car on in, I had all these details. I told this AI all these problems that I had when I took my car on in, and they said, oh, they're trying to upsell you. Next thing I know, I uploaded a photo of something that was wrong with my car, and it completely about faced. So let's think about it this way, guys. That AI needs very special prompting. You can tell it to make me a perfect clinical research resume, and trust me, I've seen quite the few, but I really want to make sure that we know what that looks like. The more detail, the better it is. Think of it this way. Do you want your wedding cake to look bland and generic, or do you want to learn how to prompt an AI to tell all the specifics to make it look intricate for that special day?
Oh, so it sounds to me like you have to know how to use AI and don't just trust it blindly. Is that the
We
takeaway?
can trust it to do our taxes, but let's listen to that when I say it slowly. You can trust it to do your taxes, but do you really want to hand it over to the IRS? The same is true for whenever that one job, dream job at Duke University, at UNC, right in my backyard. I know people here. I want to make sure that your resume isn't just AI shallowness, deep as a puddle. I want it to be broad and depth, like an ocean. I want it to have a lot of different skills to show you don't have imposter syndrome. You've got measurable achievements.
Okay, interesting. Okay, so let's just say you get through the resume piece. You've got a beautiful resume. It's consistent. It's ready for that ATS system, and you're getting that through. Sometimes in the system, they just ask you to upload your resume. Do we even need a cover letter, Julia?
Oh my God.
We absolutely need a cover letter. We absolutely need a cover letter. A cover letter is going to help you stand out. Today, some of the roles that you're going to be applying to, there could be 100 plus applicants, and a cover letter is a great way to show that you're invested and you are interested. I have experience working with hiring teams, and with those hiring teams, it was almost critical that you had a cover letter, or it was required. They don't tell you that, but when we're looking at all those applicants that come through and we've got a huge pool to choose from, we're going to go look at the ones that submitted a cover letter because it shows that they took that extra step and they care. So
Okay.
yes, we definitely
So,
need a cover
okay.
letter.
All right. Okay. So everyone should have a cover letter.
Yes.
And people ask me this all the time. God, I have so much to say on my cover letter. Like, does it have to be one page, or how many pages should it be? Can it be 4 pages like mine?
I would really only recommend that your cover letter is about a page long. We know that when resumes are looked at by a human for the first time, it's about 7 seconds, averagely speaking, and a cover letter is very similar. So we want to keep the cover letter concise but specific. We want to leave them wanting more. We don't want to tell the entire story. We want to give them a little bit of that story, but we want to leave them wanting more. And that's what the interview is for.
Okay. So 1 page cover letter.
One page.
And I've also heard, in fact, we have a slide for cover letters. And I want to share this because it's so important that people are doing great cover letters. So cover letters are necessary, but they're also supposed to be personalized. What does that mean, personalized?
We want to personalize our cover letters so we can help ourselves stand out. When I'm talking about job searching, I often relate job searching to dating because I feel like they're very similar. And the cover letter is a lot like a first message. So imagine that you have just received a message from someone who wants to take you out on a date, and they start off with, "Dear to whom it may concern." You probably would not respond to that message. Now, let's say that they did get your name. They got at least the name in there. Now, if that first message is just them talking about themselves, it's very unlikely that you're going to say yes to that date. So I often tell our students, look at cover letters the same way that you would a message that you're sending to someone that you're interested in, or a message that you would like to get from someone that was interested in you, and what would help you say yes to a date. And so with cover letters, we really want to lead with something about them first before we start talking about ourselves. I would recommend that you do some research on the companies that you're going to be applying to. Dive into their mission statement, their values, things that are important to them, maybe awards they won or the therapeutic areas that they specialize in. What about that company is exciting to you and makes you feel like you're connected to them? And that's my recommendation for personalizing a cover letter.
So personalized is about you, and then targeted, really understanding who you're submitting it to. Is that what the targeted piece means?
Yeah, absolutely. Knowing who you're writing that cover letter to. So targeted also for the job description. When you're looking through that job description, it's usually a great cheat code for what it is specifically that they're looking for. And you can find a way to connect the dots for them. That's really what a cover letter does. Your resume is a great outline of your experience and your certifications and your trainings, but the cover letter is really the story that pulls it all together and specifically aligns you with what it is that they're looking for.
Okay, I think I know the answer to this question. Can I get AI to write my cover letter for me?
I will also, just go with what Ian said, but AI is a great tool. AI is a great tool for reviewing a cover letter. It can help you with grammar, it can help you with spelling, it can help you by looking at the job description and giving you ideas as to what you might want to include in a standout cover letter. But at the end of the day, we don't want that final draft to come from an AI. I've talked to a couple hiring managers recently that have told me it's very easy at this point for them to identify cover letters that are fully written by AI. They specifically said that they had multiple cover letters that were almost identical. And so we want to keep our voice. We want to stay human in these cover letters. And the whole point of the cover letter is to really stand out and personalize it and make it feel like they're really looking at you and not just, a piece of paper.
Okay, so using AI can get you into trouble unless you're using it appropriately. Interesting. So, Ian, we've got a great cover letter. I'm sorry, great resume. Julia, we've got a great cover letter. Courtney,
So far, so good.
I want to ask you this question
Sure.
because often most people think that's all I need, right? Why is it not enough? Why do people need more than just a cover letter and a resume?
Yeah, so David, that is a great point. And Julia, you took a key word and when you were kind of going over all of your cover letter things and using AI, it is such a great, helpful tool when we're trying to put together our resumes and cover letters, but we want to make sure that we're using them correctly. Now, having your resume and your cover letter, those are a great base for when you're going through this job application process, right? You want them to be clear, concise, you want them to get through and pass through the ATS system. But then what happens to your resume and your cover letter after that? It's going to be put on a hiring manager's desk. And are you going to be the only one who's on their desk, or are you going to be sitting there along with maybe 100 other applicants that are applying to the same role? How are you going to stand out? Are you in the middle of that stack? Are you at the bottom of that stack? What are some things that we can do to really push you to the top? And that's where networking really comes in.
Okay, all right. People talk a lot about networking. Um, what does that mean? Like, first of all, how do we even start networking?
Yeah. So when we are thinking about networking, there's things that you can go to. For example, networking events that might be in your area. You can meet other people and really be that human, right? When you're thinking about these documents, this is just a piece of who you are. We want to really put those puzzle pieces together and show them who you are personally and really show that you're passionate about clinical research. How are you going to come across that this is me. This is who I am. I am so extremely passionate to this about this industry, and this is my connection. This is why I want to make a difference in this industry.
Yeah, and so much of networking these days, people talk about LinkedIn. I want to ask the audience, if you have a LinkedIn account, can you raise your hand? If you have a LinkedIn account, raise your hand, and let's just look and see how many of you have a LinkedIn account. And it looks like, oh wow, lots of hands going up. Now, I'm gonna see if we can lower those hands. How many of you feel like that LinkedIn account got you the job, right? The LinkedIn just got me a job. Oh, some hands are going up. A few of you got a job through LinkedIn, and that's fantastic. LinkedIn is a powerful tool, but you really have to know how to use it. And when we're networking, Courtney, how can we really optimize this process? Is networking something that we just do like on our own?
No. So that is the great thing about Fast Track. Our team is here to help support you along every step of the way. That includes resume, cover letter, LinkedIn. You might be the type of person who might not feel as comfortable with putting all of this in, kind of creating a profile on LinkedIn and starting that, because maybe you're starting from scratch and you really need to build that confidence on, what do I put as my profile picture? What do I use as a banner picture? What about my about me? Is it too much? Is it too little? How can I strengthen this to really stand out to other people who might be looking at my LinkedIn? Or maybe you sent in an application for a position and they're going to look at your LinkedIn to make sure that everything matches, right? So we want to make sure that we can really make it as strong as a profile as we possibly can. Again, to make sure that you are coming off as a real human, not just this piece of paper.
Yeah, the biggest thing about applying to jobs these days is you have a cover letter, you have your resume, but the network is so, so important. We say it's not always what you know, sometimes it's also who you know, and networking is the way to get there. I have a few slides that we put together, and Courtney, can you go over this first bullet point right here?
Yeah. So when we're talking about connections, we have connections to our partners in the industry who are hiring, looking to fill positions constantly. And that's where we really have built that trust and gains that partnership with them. So when we are giving them these referrals, which is a strong thing to have, right? That's just going to bring you to the top of the pile even quicker. They've hired our students in the past. They know what we're capable of. They know the things that they have done in our classroom. They have this hands-on experience. They're able to utilize our live instructors in the classroom and really get that clarification. So again, they know what they're getting. They know that they have all that background, and you could be light years ahead of other people who have already been in the industry, and you're fresh out of our program. So those referrals are really key. When you are standing out to us as well, we will send that resume out as quickly as possible to get you hired as quickly as possible.
Yeah, what we've found is to be most successful in your job search, it's really about community. It's about working together, not on your own, but when you can work with others to get those referrals, to make connections, to get the introductions. And when you have support and coaching to get there, that is really the key. I know some of you have been asking questions. You can put questions into the Q&A to ask questions. And there will be a recording of this that you can request after the show. So I know for some of you, you're going to want to look back and review some of this. But one of the questions I want to ask the group is, when we're helping our students, how are we working with them to achieve these goals of making sure that their application is going to be the best possible? Ian, let's start with you. How do you work with our students to make sure that they have the best resume possible? What does that look like?
So, first and foremost, David, I get to know our students more intimately in class. So, that's one thing that's a real benefit. In the middle of this class, you get real time career coaching in very small group settings where you're allowed to ask those questions, pitch them on over to us, get real time feedback, and we get time to practice. As an adult, I can't just look at a note card, study it, and hope for the best to be able to talk like that in an interview. You actually get one on one tips through me. We actually talk to each other. We hold real discussions. So it's not just like going on an online platform and just taking a test while you're sitting there going A, B, C, D. You're talking with people. You're learning from professionals. You're also learning from people who are new to the whole R3 standard, people who are teaching you directly in a small atmosphere. So you actually feel comfortable and safe asking questions directly to others. And that's what we do best here is it's a small, close-knit community, just like how you said, and we build it together, David. So it builds that confidence while we're all together.
Beautiful. And I do see a hand up, but if you can type your questions either in the chat or into the Q&A, please do. And we're happy to answer more questions. Julia, I saw your hand up.
That was an accident, but I'm happy to answer a question for you.
Yeah, I'm just curious, how do you work with our students to make sure that their cover letters or resumes are in
Yeah.
good shape?
Well, I'm their second pair of eyes, which is nice to have, especially when you're maybe the first time writing a cover letter or you've had questions about cover letters in the past. So I can look at a student's cover letter and help them review it. I can also cross-reference that with a job description they're looking at and help them identify what would be important to include in that cover letter. I've also been with these students all week long, so I get to know them. I get to learn a little bit about them more personally in the classroom, and so I can really help them pull out strengths that maybe they didn't know about themselves or recognize about themselves. And then lastly, one thing that I absolutely love that we can do is a lot of times our students are going after positions at companies where our students have been hired or we're partnering with that company. And so I can help them identify specifically what that organization is really looking for. You know, some organizations are really looking for a culture fit more than anything else, but other organizations are maybe looking for a specific certification or a specific skill set. So I can help students identify what it is that that organization is looking for and ensure that it's incorporated into their cover letter.
That's fantastic. I'm just curious from the audience, raise your hand if you've applied to jobs, maybe in life sciences or clinical research for a month or two, or maybe even longer and not gotten the job, not gotten hired. I see, wow, I see all these hands going up. Courtney, I'm wondering, there's so many people in the audience who have a similar experience. Maybe you can share a story about one of our students
Yeah.
that's had a similar experience.
Absolutely. I love these success stories that we have because these students of ours that come to us for this help, they trust us. Again, they find us, they talk to our team, they get to know a little bit more information, and it doesn't just stop in that classroom, right? We go beyond the classroom. We go over everything, we help you, we do these one-on-one meetings, but we have students who before finding us, they applied to jobs for months. Okay. Just recently, we had a student who was applying for jobs for 6 months on her own. Okay. There was no success, nothing was sticking. She's an IMG. Okay. And she was just kind of doing everything that she possibly could. And then she found us. She talked to our team, again, building that trust, took our program. Not only did she gain that trust with us, she then gained all of this knowledge in the classroom. She did those hands-on activities. She was learning all about protocols, informed consent, and everything in between. Now, after she finished the boot camp program, we worked on her resume, her cover letter, her LinkedIn. We got them top notch, ready to go. Okay. She was putting in the work. She was starting to show all these different clarifications and putting in the work to start that job application process. She did so much work and she just stood out to me so much that I sent a referral to Southwest Rheumatology Research and she got hired within weeks. She completed our program in April and she was hired in June.
Wow. Wow. Um, I believe that was Vani
That
who
is correct.
we're talking about. And
Yep.
she really struggled before she came and took our program. And now she's thriving. Here it says she was hired in May. Fantastic. And she's working now also in June, of course. Can you share another story about another one of our students? Because I know so many people they have different experiences. And so,
Yeah, absolutely. So another student who was also, she just completed our program in May, if I can get my months correct. She just graduated as well, and she really started out with, am I underqualified? Am I good enough for this? Right? She really had that imposter syndrome. So we really took the time to make her feel more confident, go into those interview preps, really narrow down on her resume. Again, it is just so super important to have everything lined up and match and really just stand out to all of these other people who are trying to fill these roles. Now, she really put in the work. She was committed to this networking. She was making connections on LinkedIn. She was sending these messages. And after all of that, again, she was doing all the work. It is, again, it's teamwork. We're in this together. It's not just that you're on your own and we just send out referrals. We want to work together. That way it's an even stronger referral to get into these positions. Now, this person, Bianca, she was also amazing. So I ended up using her as a referral again for Southwest Rheumatology Research, and she was hired immediately as well. So I'm super, super proud of her and can't wait to see where she ends up on her journey.
fantastic. Oh my God, I love these stories. We were talking about another student just today, and I found his picture. Courtney, this is Michael. Can you share about Michael?
It is Michael, and Michael is just such a bright light. I absolutely loved having him in class. He took our class back in September of last year, and he was just a complete go-getter. The one thing with him is he has a master's, right? But he lived in a certain state, and he was in the process of moving. Okay, so he didn't have that network. He was kind of like, where do I start? I'm in this whole new place and really needed help with all of that. So he took our program. He, again, got all of that background with clinical research in our boot camp program, and we started to help him with that networking process. And I just knew that he had it in him. He was just, again, such a bright light and just so into it, so passionate about this industry. So I ended up referring him to Care Access, and he is still thriving in this position as a travel research assistant. So I love hearing updates from him as well. And he's been there for a few months now.
Yeah, I loved his mission was really he was aiming to make a difference and
Yeah.
advocating for patients and their healthcare. He really like had a big heart, and I
Mhm.
think that helped him get hired ultimately at Care Access. We have so many success stories. One of the questions is, how long does it take to get hired? And that is such an important question. And usually it depends. It depends on the individual and it depends on what they're aiming for. We have some students who have incredible backgrounds and degrees, and they're going for very high level positions, and that can take a little longer. We have others who are starting at the entry level, and like Michael or Vani, they got hired, they took the class, they completed the training. It takes about 4 or 5 weeks to complete everything. And then a month after that, they are working in the field. So it can be as quick as a month, but it can take 3 and 4 and 5 months as well. It can take longer, and it really depends on the person. And we always say, in order to get the job, you have to apply. So you have to do some work too, and work with us, work with your mentors and your team. And when you're working with a great team, you will be successful. And here's another question from someone who doesn't have a degree in the health area, but wants to get into the program. And I love another story of another student had a background in apparel merchandising. I'm not sure what that is. Ian,
Tell us,
Ian,
David.
do you know what apparel merchandising is?
It kind of sounds like maybe something at H&M, maybe. I don't know. Yeah.
Yeah, fashion industry. Anyway, she came from the fashion industry, apparel merchandising, but she wanted to pivot to the sciences. Um, she applied to our program, she took our training, and now is working as a clinical researcher in the field. So the answer is absolutely you can um, work in the field even if you don't have a direct healthcare background. Another question that people always ask is, so many of these positions ask for 1 or 2 years of experience. What do we do with that? How do we handle a job description that says 1 or 2 years of experience, but it might say entry level? It might be a research assistant or a coordinator. Courtney, what do we do with those folks?
So when we are looking at different job descriptions that are asking for 0 to 2 years of experience, it doesn't necessarily mean that you are not capable of getting that position. You have taken our program again. Like I said before, right? You're taking our program, you could be light years ahead of different people who are already in the industry. So really highlighting all the things that you've learned in class, and you use that terminology that could come off when you're making these connections. You go onto LinkedIn, it goes right back to networking. You go onto LinkedIn and you start connecting with people, you're messaging people, and we can help coach you on how to start those conversations, especially if you aren't totally comfortable with it at first. But once you have these conversations going, you're building that relationship, you can start talking about, hey, I saw this position online and I took this boot camp program and I really learned all the nitty-gritty details about clinical research. And that could really put you aside from everybody else as well.
Absolutely. There's something that we always talk about, and I want to share these slides too, about how to break into the industry. There's a few things that the industry is looking for, and first of all, they're looking. They use the word experience, but really what they're talking about is training. You have to have the right kind of training and coaching and support to get in the industry, and without that training or experience, it's going to be really hard, and we can definitely provide that. The other thing is community. Having a network that you can rely on, that you can work with, and having a team like Courtney and Ian and Julia will really, really make the difference. And with that, of course, you also have to have consistency. Can one of you talk about what we mean by consistency? We talk about it a lot. Ian, what do we mean when we say consistency?
Well, realistically, it's just like how we go back to it, David. We're looking at a community effort, right? One thing I love to know is whenever I've got a real go-getter right in front of me who says, Ian, I'm going to go ahead and apply to 5 jobs, 10 jobs this week. And in addition, I'm going to reach out to 10 different people at each of those jobs. So let's factor in everything we've learned together. Let's go back over our notes, everyone. Got to make sure we have a resume. Got to make sure we have a cover letter. And that LinkedIn business is big, right? Let's be consistent by maximizing all of those, making sure that resume is going to be consistent with the same type of that cover letter, and also maybe even consistently sending over video resumes, David. I'm sorry if I'm jumping the gun on that one too, but consistency with something like that shows that you're a true top 1% candidate, right? Here in the United States, we're looking for that top 1%er, right? So if I see consistency, clarity, and that true attention to detail, David, those nice notes that people send to me after an interview, I see something that comes from the heart that shows that you listened to me in the interview as well. That's what I'm looking for, David. That's the consistency that gets you the job. Not being passive, being active in today's market.
I love it. And really, really helping yourself stand out. Another area of consistency is persistence. Consistent, if you apply to a job and you don't get it, you don't want to throw in the towel. You want to consistently move forward and work with your team and your community to get there. We have a few more questions that I want to make sure we get to before we wrap up today. Oh my gosh, there's so many questions. This question is from someone who has a very common background of someone that we work with all the time. This is from an international medical graduate from India, so a doctor. And often these doctors come to the United States and they're not able to practice medicine here, but clinical research is really an ideal profession to work in. The challenge is if you just apply with your medical background, that's not enough.
Mhm.
And that's why we work very closely with these international medical graduates. Wasn't one of the stories that you told, Courtney, which one of our students that you just mentioned was
Yeah, that was Vani.
Vani, right? Vani was applying for 6 months before taking our training. But once Vani had the training and the support, the referrals, she stepped right into the industry. You do need to have your own work permit, though, however. Very important. Excellent question. And thank you for that question. And now here's someone with, wow, a pharmacy degree and a master's in healthcare informatics. What great experience. It sounds like this person is still trying to get a job, right? So you have a great background, you're applying to your roles, and what everyone needs to know is you want to practice, right? If you interview for a job and it doesn't work out, you have to make sure that you're preparing, that you're working with a team, and you're getting the mentorship and advice you need to get there. Did any of you have anything else you want to share about that mentorship and support in the interview process?
Julie, I think you're about to say something. Is it just me?
Ian, you are up.
Okay, got you. I'll go ahead and make sure everybody knows this. Key thing that's a green flag for me is professional development. Remember, guys, I'm big on notes, so I want you guys to have that down pat. Now, we've talked about professional development through LinkedIn. We've also talked about it like, how do we get it through this program? So remember some of that alphabet soup we've talked about. ICH, GCP. Let's say that you're applying for this job. Yes, you do have a background, a medical background. That's wonderful. But are we talking their language? Maybe not exactly the way that they want us to talk. It's more broad medical understanding than the specific understanding of clinical research. What about Alcoa C principles, right? We go into that detail so that you can bring that up in your summary, in your resume, bring up, oh, I just attended an 8-day intensive training boot camp, wonderful green flags in the sky. That's what they want to see from you. Something that says American professional development, lightning fast speed, ready to go. And that's what we offer.
Fantastic. We only have a few minutes left, everyone, and we have a few more questions that I'm going to get through. We won't have a chance to get to all of them, but I do want to answer just one or two more. This is from a physical therapist who is ready to make a career change. In your 40s, not a problem. This is a perfect time to get into the industry, and 40s, you're in your prime. So I do think that could be a wonderful opportunity to move into clinical research. Here's one, someone who has a gap in their resume. Julia, we've helped a few people with gaps in their resume. We don't have time to go into all the details, but that is something that you've helped with people in the past. Is that right?
Yeah, absolutely. Gaps in the resume are common. They're definitely common, but we can overcome the questions that come along sometimes when you're looking at a resume gap by filling the gap. So my biggest recommendation is if you have a resume gap, fill that gap in your resume. So give them some detail behind what was happening during that gap. Was it a travel break? Was it a relocation break? Was it a career break, an education break? Give them a little bit of information, and don't forget to include what you were doing during that gap. Maybe you were volunteering. Maybe you were pursuing a certificate like Clinical Research Fast Track. You want to talk a little bit about what you were doing during that time. It's a smart choice to fill that gap before they have questions. So answer the question before they have it.
Wow. And on that note, I want to thank everyone for joining us today. We do have our training classes coming up. We have our next class in July. It's July 26th through August 2nd. This is the 8 days of boot camp training. It's complemented with pre-study, with additional post-study, and then career mentorship with yours truly. You would be working directly with Julia, with Courtney, with Ian, and our entire team, including expert instructors in the clinical research industry. And that is coming up July 26th. The pre-study goes out the week before. If you do have questions, we are closed tomorrow, but take a screenshot of this, write down our phone number, 602-883-7944, and you have our website here. Please reach out to us on Friday or next week. We are happy to answer all of your questions. To those of you that we didn't get to your questions, I apologize, but I want to thank you all on this Juneteenth Eve for joining us for this webinar on how to break into the clinical research industry in today's market. This is an incredible industry, and with the proper coaching and community and consistency, you too can enter this industry and take advantage of all the opportunities. I'd like to thank Courtney Herman coming in from Pennsylvania, Ian Fetterolf from North Carolina, and Julia Martin from Maine. Thank you so much for sharing all of your insights. Thank you all for joining, and have a wonderful night, everyone.
Thank you, everyone.
Everybody.
Thank you,
See you.
everyone. Goodbye.
Bye.
Bye.